Welcome. Are you visiting this channel for the first time? Please stay, relax, and enjoy this lecture. Let's look at the urinary bladder. The urinary bladder is a storage tank for urine. It is a region where the urine produced by the kidney accumulates before the urge to urinate begins, and that will lead to the passing out of the urine to the external environment. So this is the kidney where the urine is produced, and this is directed through a pipe that is called the ureter. This is the ureter. From the ureter, it is being emptied into the urinary bladder, and it gets stored in the urinary bladder until when the capacity can no longer expand to carry more, then stimulus is sent to the brain to initiate the process of urination. The urinary bladder is a hollow, distensible muscular organ that is made up of smooth muscle. It is hollow because it has space within it where the urine can accumulate, and it is distensible because it has the capacity to expand so as to accommodate more volume of urine. It is muscular because it is made up of muscle, specifically smooth muscle, which fibers have high tensile strength to expand and also to contract. The size and shape of the urinary bladder actually depends on the volume that it contains. So the volume of the urine in the urinary bladder would determine the shape and the size of the urinary bladder. Also, because the urinary bladder has relatives, so to say, they have organs around them, the pressure that this organ also puts on them will also help to determine the shape and the size of this organ. So all in all, we can say that when the urinary bladder is empty, when there is no urine contained within it, it tends to be triangular, and of course, it will be smaller. Or when it is filled with urine, it tends to appear rounded. So the shape would tend to be rounded and also bigger because it contains urine. So the shape and size varies greatly depending on the quantity that is contained within it and also the pressure that it receives from the surrounding structure. This can be specifically seen during pregnancy. By the time we go through with this lecture, we would see the relationship between the uterus and the urinary bladder. So we'll be able to see that the uterus is located close to it, and during pregnancy, it tends to put pressure on the urinary bladder, therefore helping to alter the shape and the size of this structure. That is why during pregnancy, the urinary bladder does not accumulate much of urine, and that is why the urge for urination tends to be increased more during pregnancy. Then the functions of the urinary bladder. The first one is that it helps to store urine temporarily before the urge to urinate begins. So it serves as a storage tank for urine that is produced in the kidney. And the urinary bladder tends to store about 400 to 600 ml of urine. Then the second function of the urinary bladder is that it helps to enhance the release of the urine that is stored within it. We said that the urine is stored temporarily, and when the urge to urinate begins, it also helps to contribute to the process of releasing the urine out of the body to the external environment. And it is able to do this because of the specialized type of muscle that it is made up of. We said that they are made up of specialized muscle that is called the detrusor muscle. This muscle has the capacity to expand and also contract. And as they do this, they're able to push the urine out of the urinary bladder to be released into the external environment. Structural components. If a section, let's say this section of the wall of the urinary bladder is taken, this is the structural component of what we would have in this space. And the first one is the smooth muscle. They are made up of specialized elastic fibers. So they have a very high capacity to expand and also to contract. And that is one of the structures that you see that is made up of the wall of the urinary bladder. Then you have the urothelium. The urothelium are epithelium lining, and the specific type of epithelium that we see in the wall of the urinary bladder is a transitional type of epithelium. If you go through our lecture on epithelium, we see what transitional epithelium is and structures where they are lined. Organs are not just lined with epithelium, they are lined based on the function that they execute. And for the urinary bladder to be able to expand and contract, it means that there's going to be a periodic change or transition of the epithelium from one form to another, depending on what is contained within them. These are the two major structures that form the wall of the urinary bladder. We also have some other structures that help to support these two basic structures, and this will be seen in the histology lecture of the urinary bladder. The regions of the urinary bladder. The urinary bladder is divided into different regions, and the first one is the apex, because we say that it appears somehow triangular when it is empty, and when it is filled with urine, it tends to be rounded. So the apex of the urinary bladder is directed towards the pubic symphysis. This is the pubic symphysis highlighted in black. This is the region where it is formed around the anterior midline plane within the pelvic cavity. So this region is the pelvic cavity, this is the anterior region, and this is the posterior region. Specifically, we are using the male pelvics to do this illustration. So this is the anterior side where we have the penis, and this is the posterior side where we have the rectum, and the opening of the rectum, the anus downward. So this is the urinary bladder that is located within the pelvis. And we say we have the apex. The apex is the anterior part that is pointed towards the pubic symphysis. And this is the sharp pointed anterior edge. This anterior edge is connected to the median umbilical ligament. This is the median umbilical ligament that extends from the apex of the urinary bladder, and it is running to be inserted on the umbilicus. That is the depression that is seen in the anterior part of the abdominal cavity. So it runs upward and it's inserted on the umbilicus. And this ligament tends to create a structural support for the urinary bladder by attaching the apex of the urinary bladder to the umbilicus upward. And this is the apex of the urinary bladder. Another region is the fundus. The fundus is the posterior expanded part. This is the fundus. It is located at the back and it is like a bulge. This fundus helps to create more space within the lumen or the cavity of the urinary bladder to accommodate more urine. Then we have the body. This is the body of the urinary bladder, the central region of the urinary bladder. And we have the neck. The neck of the urinary bladder is the inferior constricted part of the urinary bladder. And this is the neck of the urinary bladder. And it is at this point that urine emptied into the urethra. And this is the urethra. So it's like a constriction that helps to narrow down the exit point of the urinary bladder so as to allow the passage of the urine through the urethra. So this is like a constriction that is created, and this is the neck of the urinary bladder. So these are the regions of the urinary bladder that we have highlighted. Talking about the location of the urinary bladder, we have the urinary bladder located in the lesser pelvis. We already know the configuration of the pelvic cavity. If you go through our lecture on the bony pelvis, so regions above this brim is called the greater pelvis, and the structures that we see within this space are the lower abdominal viscerals. Then distal to the pelvic brim is the lesser pelvis. So you have the urinary bladder located in the lesser pelvis, and also it is sitting on the pelvic floor. The pelvic floor is the inferior limit of the lesser pelvis. It is a collection of muscle that forms the pelvic diaphragm, forms the limit of the lesser pelvis. So you have it in this region in the female, and you have it around this space in male. So that is where the urinary bladder is sitting on within the lesser pelvis. There is a distinct differentiation in terms of the organs that are related to the urinary bladder in both the male and the female. So let's quickly look through this. In terms of relation, in male, we have the pubic symphysis and we have the urinary bladder located behind it. Posterior to the urinary bladder, we have the rectum. This links to the gastrointestinal tract. So we have the rectum behind the urinary bladder. This is the rectum behind. We have a pouch that connects the urinary bladder with the rectum. This is the rectovesical pouch, and this is the rectovesical pouch. This is a fold of peritoneum that tends to connect the urinary bladder with the rectum. It's just like creating a support or a form of connecting network to the rectum. So you have it connecting with the rectum posteriorly through this pouch. And anteriorly, we already know that the apex is connected to the median umbilical ligament that helps to connect the apex of the urinary bladder to the umbilicus upward. So the urinary bladder in male is held by a ligament anteriorly and also by a pouch posteriorly. So this is how it is. Then more distally, around the neck of the urinary bladder in male, we tend to see a structure that is highlighted in blue, and this structure is the prostate gland. This prostate gland helps to give a structural support to the urinary bladder inferiorly. It has its own function though, but in the way of supporting the urinary bladder, it tends to like help to hold it in place at the inferior region. Then in female, it is a different ball game because of the peculiarity of the female reproductive system. We know that the uterus is located within the pelvic cavity. Of course, it will have its own space within that region. We already know the background. This is the pubic symphysis. This is the urinary bladder. And of course, the apex is connected to the medial umbilical ligament. Posteriorly, in male, we have the rectum. In female, the uterus is placed between the rectum and the urinary bladder. The uterus is placed anteverted over the urinary bladder. So this is the urinary bladder, it is placed anteverted over it. That is the way it's hacked over the urinary bladder. So it is seen between the urinary bladder and the rectum. While in male, because there is no uterus in male, there is a direct connection between the urinary bladder and the rectum. The uterus is placed in between these two structures in the female. And this can be used to justify the reason why during pregnancy, a pregnant woman will be asked to take a lot of water so that more urine will be produced and stored in the urinary bladder. And this will make the uterus to stand more upright so that the scan can pick whatever that is contained within it. We also have pouches that tends to link these structures together around this space. So the first one is the vesico-uterine pouch. All we need to do is, as we've always done, is to break the name down, vesico and uterine. So it connects the urinary bladder with the uterus. Vesico is the urinary bladder. So it connects the urinary bladder with the uterus. Then the second one is the recto-uterine pouch. We have a fold of peritoneum that connects the rectum with the uterus at the back. So it's just to hold or give structural support to these organs. Apart from these pouches creating structural support in female, they also help to create a means through which the uterus can expand during pregnancy, so that as the fetus continue to increase in size, they will also create space for it to expand. Then sphincters, urinary bladder considering the function in helping to store urine. For them to store urine needs to be taken from the kidney where it is produced from down through the urethra to be emptied into the urinary bladder. And when it is filled, the same urine will need to be pulled out to the external environment. These structures need to be guided and protected to prevent backflow of urine. So that is the essence of the sphincter. Either backflow into the urethra, and this may tend to move up into the kidney, and this can be dangerous, or also within the urethra, preventing backflow into the urinary bladder, where it's supposed to be emptying out. So let's look at the two major sphincters that we have around the urinary bladder. The first one is the ureterovesical valves. These valves prevent the backflow of urine from the urinary bladder back into the urethra. So a valve is created around this region that helps to prevent the backflow of urine. So it's created around this region to prevent backflow of urine into the urethra. So we have one at this region, we have another valve at this region. Then the next one is the urethral sphincter. The urethral sphincter is sphincter of the urethra, and this is the urethra. So they also have a number of sphincters that also helps to guide or direct flow downwards. And also they help to prevent the backflow of urine into the urinary bladder. And this is the urethral sphincter. So we'll take the valves and the sphincters one after the other to see what they present. For the ureterovesical valves, there are two. We have one on the right and one on the left side. So they are located at a point where the ureter links with the urinary bladder. So you see it around this region. To enhance the prevention of this backflow, there is a curvature that is created by the ureter around its entry point into the urinary bladder. It tends to like curve over itself. It's just to also add to the prevention of backflow of urine into the ureter. So all these processes are put in place to prevent urine flowing backward The urethral sphincters. The urethral sphincters are two. We have the internal urethral sphincter, which is an involuntary type of sphincter. It means that we cannot control the action of this sphincter, and it is seen around the exit of the urinary bladder, around the neck of the urinary bladder. And this is the internal urethral sphincter. Then we have a lower one that is located more distal to it, and this is the external urethral sphincter. This external urethral sphincter is a voluntary type of sphincter. You see strands or fibers of this sphincter running to be inserted on the pubic bone. So they tend to be voluntary, so we can control the action. And that is why we see that there are points or situations whereby the urine, we can feel that it's almost coming to the outside, but we still have some form of control over its removal out of the body. It is at this point that this is being presented, because at this region, there's still a form of voluntary control. So these two sphincters are sphincters that helps to control the release of the urine that is stored in the urinary bladder through the urethra before it's finally released to the external environment. And this is the external urethral sphincter. Then we have the trigone. The trigone is a smooth inverted triangular space that is seen around the neck of the urinary bladder. And the angle of this triangular space is formed by the three structures that empty urine into the urinary bladder and the one that takes urine out of the urinary bladder. For the two lateral angles, they are formed by the ureteric orifice. The ureteric orifice are the openings on the wall of the urinary bladder that is formed by the ureter. This is the ureter bringing urine from the kidney, emptying it into the urinary bladder. They form an orifice in the urinary bladder, and this orifice forms one of the lateral angles of the triangular space that is called the trigone. Then the inferior angle is formed by the opening of the urethral sphincter. This is the urethra that takes the urine out of the urinary bladder, and this orifice is formed by the urethra. So they tend to form an inverted triangular space around the neck of the urinary bladder. And this structure will help in the process of urination because they are highly sensitive to expansion. So when there is expansion of the urinary bladder and the expansion gets to this region, signals will be sent to the brain for the process of urination to be initiated. So let's quickly look at the steps involved in the process of urination. Before urine will be passed out of the body, it needs to be produced. So the first step would be the production of the urine in the kidney. Then the second step would be the accumulation of the urine in the urinary bladder. And this is able to come to pass because of the rugae that is formed within the internal wall of the urinary bladder. These rugae are folds of mucosal lining, and they tend to thin out or gradually disappear as urine is being emptied into the urinary bladder. And this tends to create an allowance for expansion of the urinary bladder so as to accommodate more urine. This will continue until it is filled to capacity. When it is filled to capacity, there's going to be a form of expansion created. And this expansion, when it gets to the trigone region, as we discussed in our previous slide, which is an inverted triangular space that is sensitive to expansion, there's going to be the activation of the stress receptors in that area, and signals will then be sent to the brain. And this will stimulate the detrusor muscle, which is a specialized type of muscle that the wall of the urinary bladder is made up of. This tends to stimulate its contraction and also stimulate the relaxation of the urethral sphincter through which the urine will pass through before it can be released to the external environment. As the contraction of the wall of the urinary bladder and the relaxation of the urethral sphincters occur, this is able to cause the release of the urine, and that is how the urinary bladder gets to be emptied. The blood supply of the urinary bladder. The blood supply of the urinary bladder is complex and also very interesting. It comes from two major supplies, which include the superior vesical artery and the inferior vesical artery. The superior vesical artery, from the name, it supplies the upper region of the urinary bladder, while the inferior vesical artery supplies the lower region of the urinary bladder. But there are differences between the male and the female urinary bladder in terms of blood supply. So let's look through this. For the superior vesical artery, it branches from the internal iliac artery. We already know that this is the lower part of the abdominal aorta. So at the terminal end of the abdominal aorta, we have it bifurcating into two because we have two lanes downward below the trach. So when it bifurcates into two, we have the common iliac artery on the right, and we have the common iliac artery on the left. So we have the right common iliac artery, we have the left common iliac artery. The common iliac artery will further subdivide into the internal iliac and the external iliac, and that is why they are called the common iliac artery. So the common iliac artery on this side will further subdivide into the external iliac artery, which goes down to supply the lower limb, and we have the internal iliac artery, which enters into the pelvic cavity to supply the pelvic viscera. So this is the internal iliac artery. So the branches that supply the urinary bladder are from the internal iliac artery. In male, from the internal iliac artery, we have a branch that emerges at the upper part, and this is the superior vesical artery, which supplies the upper part of the urinary bladder, and this is the superior vesical artery. More distally, we have the emergence of the inferior vesical artery, which is also a branch from the internal iliac artery, and this is the inferior vesical artery that emerges distal to the superior vesical artery, and this supplies the lower part of the urinary bladder. For the female urinary bladder is a bit different. In the upper region, we have the emergence of the superior vesical artery as seen in male, and this supplies the upper part of the urinary bladder. But in the lower part of the urinary bladder, we have branches that emerge from the vaginal artery. So the vaginal artery gives branches that supplies the lower part of the urinary bladder in female. Vaginal artery is like the homologue of the inferior vesical artery in female. So for innervation, I've tried to present the innervation of the urinary bladder into this simplified format. The urinary bladder is supplied by sympathetic, parasympathetic, and somatic innervation to the urinary bladder. So for the sympathetic innervation of the urinary bladder is supplied by the hypogastric nerve. The hypogastric nerve has the lower part of the thoracic spinal nerve to the upper part of the lumbar spinal nerve. So we have T12 to L2, and this emerges. It's called the hypogastric nerve, and this supplies the sympathetic innervation to the urinary bladder. Sympathetic innervation are innervation that are exhibited during emergency situation, and the action that this shows is the relaxation of the urinary bladder. And this is the sympathetic innervation, the hypogastric nerve that gives sympathetic innervation to the urinary bladder. For the parasympathetic innervation, that is during the normal state. You are not under any pressure, it is in the normal state, and this is supplied by the pelvic nerve. And the pelvic nerve emerges from the second to the fourth spinal sacral nerve. And this is what supplies the parasympathetic innervation of the urinary bladder. Apart from the pelvic nerve giving parasympathetic innervation to the urinary bladder, it also helps to control the action of the internal urethral sphincter. The internal urethral sphincter is located around the neck of the urinary bladder, and it is an involuntary type of muscle. So the pelvic nerve also helps to control the action of this sphincter. Then we have the last one, the pudendal nerve. The pudendal nerve supplies the urethral sphincter. That we mentioned earlier that it is a voluntary type of sphincter. You can actually control its action. So it is being supplied by the pudendal nerve, which also emerges from the second to the fourth spinal nerve. And this tends to provide voluntary control over the process of urination. And this is the pudendal nerve. The clinical anatomy I want to look into is urine retention. And this is the condition whereby the urinary bladder does not completely empty the urine out to the external environment. And this can occur as a result of obstruction seen within the lumen of the urinary bladder. This can be caused by hardening of minerals, which tends to form like a stone-like structure. And this tends to block the passageway of the urinary bladder. It could also be formed as a result of large blood clots that tends to occlude the lumen of the passageway, thereby limiting or reducing the quantity of urine that is being taken out of the urinary bladder. Also in males, specifically, prostate enlargement can cause this condition. And this occurs as a result of the enlargement of the prostate gland. We know that the prostate gland is located distal to the neck of the urinary bladder. And when it becomes enlarged, it will tend to put pressure around the lumen, thereby constricting the space that is around the prostatic urethra. This can lead to urine retention. So thanks for watching this video. Let's stay tuned for more lectures.